Let's find out about this health care plan, the temporary plan put forward by Senators Alexander and Murray today. Where things stand. Joining us from Capitol Hill, Senator Lamar Alexander of Tennessee. Senator, thanks for being here.
Thank you, Brett.
Where do things stand? You rolled this out today, but what are its prospects?
I think its prospects are pretty good. We rolled it out with 24 Senate co-sponsors. That's a fifth of the Senate, a fourth of the Senate, really. Half Republican, half Democrat. The proposal is something that almost all Republican members of the House have already voted for. It was in the repeal and replace bill in the House. All the Democrats want it. The president's interested in it. And the leaders of the Senate repeal and replace bill, Senator Cassidy, Senator Graham, are for it. So it's there for people to consider, to improve. And I hope that it sounds like something to me that's likely to become law by the end of the year.
All right, I want to ask you, you said the president's interested in it. This was the Rose Garden press conference 2 days ago when he was asked about this bill.
Has the White House been involved in those negotiations, and will you support that deal?
Yes, we have been involved, and this is a short-term deal because we think ultimately block grants going to the states is going to be the answer. That's a very good solution.
So that sounded positive, but the next day in the cabinet room he said this.
If something can happen, that's fine, but I won't do anything to enrich the insurance companies, because right now the insurance companies are being enriched. They've been enriched by ObamaCare like nothing anybody's ever seen before. I am not going to do anything to enrich the insurance companies.
And he doubled down on that. He tweeted that he supports you, but can enrich the insurance companies. So how do you get the president on board to this bill?
Well, we 100% agree. He and I have talked about it. You know, he called me about 12 days ago and asked me to do this. He said we need a short-term agreement so people don't get hurt between now and the time we repeal and replace Obamacare, which takes a couple of years. He said, I don't want to bail out the insurance companies. So in our bill, there's about a page and a half of language that makes sure that the benefits go to consumers, not the insurance companies. And if the president has better and stronger language, why, we'll put it in. I've talked to him about it. I agree with him. Senator Murray agrees with him. We're all on the same page on that issue.
So when you heard the evolution of those statements from the Rose Garden to the cabinet room, what did you think?
Well, I didn't. Here's what I thought. I've talked with the president 4 times in the last 12 days. 2 times yesterday, so I know what he thinks on this. I mean, he asked me to do it. He's encouraged me to do it. All we're asking him to do is to consider a proposal that he wanted to have. So I'll give him credit for seeing the need for a short-term bipartisan solution and engineering it to be done. So now he's got it. He can decide what he wants to do with it. I think he'll probably like it after he fixes it, improves it, and I think it's likely to become law.
And to his main charge about not bailing out insurance companies, you're saying your bill does not do that.
Oh, no, it doesn't, because cost-sharing payments are payments that the government makes to low-income Americans to help pay for co-pays and deductibles. Those are the beneficiaries. And what our bill says is that every state has to come up with a plan to make sure that happens in 2018. It automatically happens in 2019.
The Speaker's office did not sound that positive. The spokesman putting out the Speaker does not see anything that changes his view that the Senate should keep its focus on repeal and replace of Obamacare. So are you worried that even if it passes the Senate, it's kind of doomed in the House?
Well, I don't think that. See, the House has already voted for this. See, it was in the repeal and replace bill that passed the House. What they did was to say they would continue the cost-sharing payments for 2 more years. The only thing different about our proposal is that we make it legal to do that. And the reason for it is almost everybody understands that as you switch from Obamacare to a different system, you got to have something in the transition or you create chaos for people. Your premiums go up, and according to the Congressional Budget Office, you might have 16 million Americans who live in counties where they couldn't buy insurance at all in the individual market. So nobody wants that. And I think as people read the bill, they'll see it doesn't bail out insurance companies. It avoids chaos. Chaos is a big birthday present for Bernie Sanders. Leads right to a public option, right to a single payer.
2 more quick things. You've said that there are conservative elements in this bill that Republicans can rally around. Besides giving states flexibility, what are those?
One is a catastrophic insurance plan, a new policy that you can buy with lower premiums and higher deductibles. The big thing in the bill is it gives states the flexibility to approve waivers like the Iowa waiver, or the Alaska waiver or the Oklahoma waiver or Minnesota or New Hampshire, when states have asked permission of the federal government to create different insurance plans with more choices and lower costs. That's something we haven't gotten in 8 years of debate. It's in this bill.
And last thing, when the president says he believes he has the votes on another effort of Graham Cassidy in the new year, do you think anything has changed from the last time you voted?
Well, I think what could change between now and next year is a better process. That we do better when we go through committee, when we vet a bill, when we have more time to do it. They did that in the House. They got a result. We didn't do it that way in the Senate. We didn't get a result. So I think that's the difference that is likely to make a difference in 2018.
Senator Lamar Alexander, we appreciate your time.
Thank you, Brett.